Good afternoon, everyone, and thank you for joining. We are pleased to have you with us today for today's webinar on bridging urban and rural missions, creative APLU partnerships, which is sponsored jointly by the Commission on Food, Environment, and Renewable Resources, CFERR, and Urban Serving Universities, USU. Between CFERR and USU, over 150 public and land-grant universities are represented at APLU. This webinar will highlight collaborations between APLU institutions in different contexts to meet the needs of today's learners and the communities in which they reside. Specific examples will include partnerships in the areas of medicine, dental care, veterinary services, and sustainability efforts. Further, this webinar will address the tension between serving a place-based mission and programming for scope, scale, and maximum state, regional, and national impact as a public research institution. I now welcome my good friend, Molly Agarwal, Chancellor, University of Missouri, Kansas City, to provide comments on the concept of urban and rural institutions collaborating together to achieve a common mission. Chancellor, welcome.
Thank you, Chancellor Howell. Welcome, everyone. It's a pleasure to be here. I'll be moderating the session today, and I thought I will start by reminding everyone why state universities exist in the first place. And I'd like to go back to the Morrill Act that Abraham Lincoln signed back in the 1860s. And if you go, and they created the land-grant universities. And although not all of our state universities are land-grant universities, I would say that the derivatives of that law that was passed back then. So if you look at the deliberations that took place in Congress at that time, they were trying to establish the land grants because the few universities that existed at that time were concentrated in the northeast part of the country, and they were usually only for the rich and the already well-established. And the conversation said we need to establish universities to increase the prosperity of the people. And so back then, you saw a lot of those universities had mechanical engineering for farm equipment and ag as their first few disciplines. So what does that mean in today's context? Well, I would say prosperity in today's context would mean economic prosperity, health prosperity, social prosperity, and cultural prosperity. I think our role has increased. And so let's just take that and park that on the side and keep that in mind as we go through the rest of the session. And I would like to postulate that today, partnerships have become increasingly important for public universities. Question is why? Well, we have increasing pressures of all different kinds. There's declining state financial support for sure. There's demographic and enrollment cliffs that are about to happen or have already hit some of our universities. There's different and rapidly changing workforce demands. And there are expectations for measurable social and public impact. And we are hearing this more and more. So I would say that the mission for the universities has changed, not just from serving the locations where we are situated, but to the cities and to the regions and to the entire states. So this gives us an opportunity to collaborate with universities in different locations, especially urban and rural-based universities, to look at our strengths and see how we can better serve the public. We have a great opportunity here today to listen to a variety of partnerships that have been formed over the past many years from all across the nation. And we'll have examples from healthcare, from sustainability, and animal and human health at the same time. So I'll start off by talking about a partnership that we have developed here at UMKC, University of Missouri, Kansas City. In fact, several partnerships that we have involved. But let me just give you a little bit of background. We are one of the 4 universities of the University of Missouri system. Our flagship or the largest university is at Columbia, Missouri, which is, I would consider, a rural area. We are in Kansas City, which is on the western end of the state, and a metro area with it's split between 2 states, and we serve both the areas, and we're about 2.4 million people here. We happen to be the only public dental school for the state. We also happen to be the only public pharmacy school for the state. We also have a medical school, one of the only 2 public medical schools in the state. So here's the problem we have tried to address. As is happening in many places across the nation, there's a severe shortage of healthcare providers in Missouri, perhaps more so here than other parts of the nation. We are, as I said, right in the middle of the nation, 2 big cities, Kansas City and St. Louis, on opposite ends of I-70 at the borders, and basically a rural state otherwise of 6 million people. How do we get healthcare providers to these rural areas? If you go to certain parts of Missouri, north central part of Missouri, you will find that there's only 1 physician in the whole county. So you will have to drive 50, 60 miles just to see a physician. Even a worse shortage of dentists and hygienists. I was told this by somebody who works in a rural area. Now, there's a lot of veterinarians around because it's a rural state. And they said it's easier to find someone to clean your your dog's teeth, than there is to find somebody who can clean your teeth. So its situation is so dire here. So we started to collaborate, and I'll give you a quick example of 3 or 4 collaborations we have done. First of all, in pharmacy sciences, we have 2 satellite schools. One in Springfield, Missouri, which is the headquarters of the Missouri State University system. And we have collaborated with Missouri State and put this pharmacy school on their campus in collaboration with them. It's got about 30 slots. Our home base has about 90 slots. That has worked really well. The students from Missouri State get the rights to get an interview, and they have programs that feed a pharmacy program there. We also started one for pharmacy on the campus of our flagship because they did not have pharmacy. And that also has 30 spots, and that's actually a very, very strong program. And then we have about 90 slots here on our campus. We also did something slightly different for medicine. For medicine, we went up to St. Joe, which is a smaller rural community about an hour and a half north of Kansas City. And we collaborated not with the university there, but with a major hospital system, Mosaic Healthcare. And we launched a satellite medical school over there about 5 years ago, and we have been graduating students there. Those students never see Kansas City, really. They are getting all the education up at St. Joe. They fan across the northwest part of the state. They get all the clinical work in rural clinics. What is the hope? The hope is that these students, once they graduate and finish their residencies, will find it more likely amenable to settle down in those rural areas where there's a great need. And we have started to see the effects of that because the first cohort that graduated, 2 of those people out of the 15 that graduated have already signed contracts with Mosaic Health to come back and practice there. Now, we're also looking at dental school satellite at Springfield, but also in St. Joe to see how we can launch a dental school clinical aspects of that. The dental school first 2 years a little bit more academic in nature, and we may teach them here, but then take the clinical work out there. The dental school also serves during the practice of teaching, they actually serve the community. So here in Kansas City, when we have the dental school, we provide almost $750,000 of free care to people who come to get the medical care, to get the dental care there. And these individuals would most likely not have access because they're not insured for dental care anywhere else. So it serves 2 roles. Once it will hopefully develop graduate students who are likely to settle down there because they have learned those communities, but also it serves the community there by providing dental care. So what are we doing there? We are emphasizing the institutional strengths. By the way, the dental school collaboration, if it happens, we're looking for some help from the state, will be in collaboration with Missouri Western University, which is in St. Joe, a small university of about 4,000 people. They don't have any healthcare. They do have nursing, but they don't have dental or medical. So we will be launching this on their campus. We are avoiding duplication, which sits well with lawmakers. We are providing expanded educational pathways, and we're preparing students where the needs are the greatest. So this is just one way we have been able to reach across the state, since we are the only dental and pharmacy schools, and provide the expertise that we have instead of the state having to invest money to set up different schools in different locations. So that's just one example. We have a variety of partnerships that we will discuss today. There are a couple in terms of rural medicine. The first one, I believe, will be from Alabama, from the University of Alabama at Birmingham, and collaboration with Auburn University. And we will hear a presentation by Dr. Alexis Mason and Dr. David Brown, both of whom are working with the rural medical program there. So with that, let me hand it over to the Alabama group.
Thank you, Dr. Agarwal, and thank you for letting me be a part of this important collaboration. I'm David Bram. I'm the outgoing director of the Rural Medicine Program. In fact, rural programs in general for the UAB Hirsig School of Medicine based in Birmingham. Dr. Alexis Mason, my successor, and I are both at the Huntsville campus. 21 years ago, my predecessor, the late Dr. William Coleman, former national president of the American Academy of Family Physicians, envisioned a program to encourage, recruit, mentor, and place rural Alabamians into medical school. He modeled the rural medicine program after the very successful Rural Medical Scholars Program in Tuscaloosa that actually Dr. Mason participated in. Our belief is that since there had been a huge decline in the number of rural students accepted to United States medical schools, in fact, it went down 28% in just 15 years, that it was incumbent upon us to recruit from this important group, because statistically, if you go back to the pioneers in rural medicine like Howard Rabinowitz, coming from a rural area, intending a rural practice and intending general medical practice often was predictive of future rural service. We allowed students to have marginal credentials. We realized that if your graduating class was 15 or 20 in a small county high school, that you may not have ever encountered calculus or foreign language or algebra 2 or a biology course beyond general biology. And often these students struggle mightily when they got to the university. As such, we will accept people into our program with the lower grade point averages and lower MCAT scores than the general admission. But we require these students to do a pre-matriculation year at Auburn University. And that's where our partnership with our land-grant university comes into play. We have 2 land-grant universities in Alabama, Alabama A&M and Auburn University. Auburn University is excellent for our program because there's a large number of rural Alabamians enrolled there. They have a huge course catalog with very difficult pre-matriculation courses that require our students to take, such as embryology, histology, and so forth. After that pre-matriculation year, if they make a 3.5 in this year of hard science, along with a required physical examination course and introduction to clinical medicine course, they matriculate to the Birmingham campus where they do 2 preclinical years. During that year, they are required to do a 6-week rotation with a family physician, usually their own family physician. After that, they go up to Huntsville and we do the clinical years here. There's a 1-month rural rotation as a third-year student. They may also do some clinical elective work. And most of them are invited to join our integrated residency, which is the next tier. The integrated residency aims to do two things. Number one, to introduce the students to longitudinal care. These fourth-year students are given a cohort of patients that they follow from the entire year through the family medicine clinic, while they take coursework ranging from cardiology, ER, PEDS, ICU, OB, and rotations in family medicine and internal medicine. At that point, we are proud to say that we've had some fairly good outcomes through the years. You know, even though our medical school, our flagship school in Birmingham, only produces a handful of family physicians and rural physicians, we found that over the years, since the first graduating class of 2011, that of our family physicians, 64.5% of them practice rural medicine and 87% remain in Alabama. We also produce a number of other students. And in fact, those that go into surgery, med peds, general internal medicine, or other specialties, 14% end up in rural practice, but 72% remain in Alabama. Now, for the university as a whole, it's less than 45%. So the rural medicine program, to me, and I say this humbly because I didn't begin the program, it's accomplished its mission. And I think our partnership with the land-grant university is a hugely important part of that. And I look forward to this association going forward. Thank you very much.
Thank you. We also have a presentation from a different part of the country, from Nevada, the University of Nevada at Reno, and then the University of Nevada at Las Vegas, on a different topic, not health, but sustainability. So with that, let me introduce Dr. Jacob D. Decker, who's the Director of Extension and is the Associate Dean for Engagement.
Great, thank you so much. And I have a slide deck I'm going to prepare, so if we could bring that up, please. And as that's coming forward, I can go ahead and set the stage just a little bit, and this will be on my third slide. But really in Nevada, we have two universities that are serving the Las Vegas community. And there's more than that, but we'll focus on University of Nevada, Reno, that's located on Reno, Lake Tahoe area, which is northwest part of the state, and University of Nevada, Las Vegas, which is located in the heart of the Las Vegas community. University of Nevada, Reno has been around since the 1876, as a part of the 1862 land-grant university, and UNLV established in 1957 in the heart of Las Vegas. And as the Las Vegas community has continued to grow, actually the population of Las Vegas now is approximately 70% of that of the state of Nevada. So we have a lot of folks based in Las Vegas. It continues to be a really important population hub. So both universities continue to grow to see how we can serve, how we can be engaged in that important community. Extension, of course, has been there since about 1914, and we have 7 different locations across Las Vegas. So over time, obviously, there's been some competitiveness as well as some collaboration between the universities and in different spaces. But we felt in about 2023, it was probably time to renew some of those partnerships, and really starting with the presidents, President Brian Sandoval, University of Nevada, Reno, and then President Keith Whitfield at UNLV, really came together and set a new tone and set expectations. Not that we haven't been collaborating, because we have, but kind of take it to the next stage. And I would say not only kind of set the tone for the universities, for our faculty and staff and what those expectations are, but publicly as well, for elected officials, for others that maybe had the perspective that we could be partnering better, how we could serve Clark County, how we could serve Las Vegas a little bit better than maybe what we had before. So we kind of created that partnership and realized that Extension was the perfect vehicle to really realize this opportunity and advance this need. So Extension really served as the mechanism. I was asked to kind of put together a plan for what that would look like. I shared that with both provosts. They approved it, and we moved forward with Better Together to kind of launch this Better Together initiative on how UNLV and UNR and UNR Extension could really work together collaboratively for the betterment of Clark County. We had an event that we held it at our extension offices, both presidents there. You can see the picture on the right, President Sandoval and then President Keith Whitfield of UNLV coming together to kind of set the tone of what we're going to do. As a part of what we did, as far as that effort, was really set a plan. And I won't go through all the details of that plan on what those specific new partnerships, kind of an elevated partnerships, would look like, but there's one particularly I want to be able to focus on. That was an effort where we intentionally brought our faculty and staff together. We called them joint roundtables. We brought them together on children, youth, family as one topic, health and nutrition as a second, and environmental sciences, natural resources stewardship is kind of a third topic. We needed a carrot. So what was the motivation for faculty to kind of come together other than the president's kind of setting the tone that this was an expectation. This is what we wanted to do moving forward. To do that, we put some competitive awards together. An extension put $1.7 million on the table to foster collaborations and research partnerships that served both institutions' mission. So faculty came together, they presented about 3 to 4 minute presentation on what their topic is, why it's important, and why they want to partner, what those partnership opportunities are. These are some pictures of that. The applications that came from that had to be joint engagement. It had to be UNLV and UNR extension faculty that are co-PIs on that effort. It had to be applied research, and we had to really explain what applied meant in some communities. It had to be mission-centered for what our mission is, what UNLV's mission is. Community needs, obviously a big part of extension, community impacts, and it had to be sustainable. This was dollars to invest, to seed, to start some of this work, but we expected it to be able to move forward on its own. I have a little video I wanted to show that I think kind of captures the spirit of what we tried to foster here, and we're successful in doing so. So if we could start that video, please.
UNLV, University of Nevada, Reno, there is so much opportunity to work together.
We can better collaborate, cooperate, to be able to help the citizens of this state do better, have more opportunities.
We're going to be stronger together because UNR has a lot of capacity and cooperative extension here in Clark County that does a lot of important work, and UNLV also has a lot of capacity and a lot of people are out in the community doing important things. And if we team up and make sure that our efforts are well coordinated, we're going to be even better supporting this great community.
Both universities have great faculty, great academic programs, and we complement each other in a lot of areas. But we also have strengths in different areas. And this is an opportunity to bring those strengths together to serve the people in Clark County.
And we have an amazing opportunity to help people. We have 2 great universities.
What we buy into is that we're better together. What we buy into is that 2 great universities make a great state.
But when you're in the middle of history, you don't realize you're making it. And I think this is one of those days where we will have come together and people are going to point back to this day and see what we've been able to do together. There's a lot of capacity and there's been a lot of conversation, and now is the time for action.
This is the beginning of UNLV and UNR working together for the citizens of Clark County.
Thinking about an outreach arm coming from the foundation of the universities, enriched in scholarship, enriched in research and knowledge, reaching out with that information, and then generously applying that to communities, to businesses, to families, to children, youth, schools, all in the community, so that the people can benefit.
Well, I think the shared programs are going to be beneficial because there's a lot of expertise on both campuses and in both organizations. Everyone who's involved in this is excited about doing everything possible to make Clark County the best place it can be.
We are dedicated to working together because we both serve the mission of supporting the citizens of our state.
So we expected maybe 25 to 30 applications to come from this. This is the first time we ever really tried this. We were really surprised to see we had double that. We had 55 applications come forward from that effort of faculty putting together those efforts that met those criteria that we established. And we had 9 that we awarded. And the individuals that selected that were 2 provosts, a couple deans, and myself that we felt best met the criteria that we had established there. The faculty really rallied around this. They were excited by the opportunity to come together. They were excited by the tone the presidents had set around those expectations and really fostered a lot of creativity, new relationships, kind of what ifs. Could we partner together and be better because of this? So really excited that it generated, I think, the vibe that we were hoping to from this and get these number of research proposals. So as I mentioned, we have 55 applications, really hard to choose We selected 9, and today I kind of want to talk about just 2 of those 9 a little bit. So the 2 I'll talk about are more in the environmental science area. One, water conservation, management, and savings. Obviously, living in Las Vegas and even Nevada as a state, very low. We have a lot of dry land usage. Water is an extremely limited resource. So this is an important topic. One of the goals of this particular project was develop Nevada weather station network across the Las Vegas Valley. We wanted to help golf courses, parks, municipalities, et cetera, make more informed decisions, data-driven decisions to help irrigation and other water management practices. We gave a number of accurate estimates through this project to really help more efficient management. And like I said, in one of the nation's most water-limited regions. So some of the outcomes. The network had 5 stations that we did create. We partnered with 4 golf courses and with the Golf Course Superintendents Association that really helped us pilot the network. They provided tremendous feedback and they gave us a lot of great information and continue to really use that to say practically this is what we need. And we are going to use this on a daily basis. We created a NevMet website that provides public access to that data in real time so that users across Southern Nevada can use it, and provide a number of resources from that. So this is one example of, I think, a project that met community needs, met Clark County needs in a real way, and continues to help inform the public and make measurable differences on water management and water savings. So the last research project I'll highlight is that of increasing toxicity of heavy metals in water due to the continuous drought and the population growth that we've seen here in Las Vegas and Clark County. So we wanted to really understand how those factors affected heavy metal concentrations in Nevada's water sources, particularly Lake Mead, Las Vegas Wash, and Lake Tahoe in northern Nevada. It was able to increase public awareness and develop educational resources to provide water quality information through websites and distributing water kits to communities and a number of fronts. That was the intent. And now then the outcomes, the research identified elevated concentrations of some of the heavy metals, but they really remain below levels of immediate public health concern, which is great. But one of the key parts of this is really strengthening partnerships. We have a number of agencies, governmental groups, and communities that work within this space, as many states do. And this was another example of how the universities can work together to provide data, scientific resources, to our state agencies and governments on how we can work collaboratively to really help solve some major issues. So it's just strengthened those partnerships and work continues within this space. So what's next? So what did we learn, I guess, through this, in addition to what's next? But we have many joint applied research projects that are just finishing this year. So they're working on their impact reports. They're putting those things together, and we'll have more data for how successful this was in the coming months. We did have a lot of faculty relationships that were strengthened. Some folks knew each other before, some were brand new relationships, and many have decided to pursue new grant opportunities and research ventures together, which is really what we wanted to see, is more of a strategic partnership on how we could really work together in tangible ways. So excited that that has kind of occurred. We did also increase informal collaborations. Now what are informal collaborations? I would say that those aren't necessarily joint research or grant pursuit collaborations, but they're around teaching, classroom education, other educational programs, resource development on how we're still bettering the community through maybe informal collaborations. And that's really from our faculty and staff, understanding where the president's tone was and having these collaborations and working together on a variety of fronts. So excited that that has moved all the way up to 75 unique experiences per year, and I think growing. We are co-developing a children's science and nature park with the city of North Las Vegas. We have a research center and demonstration orchard that's both engaged by UNLV and Extension. So we are continuing the momentum about how we can partner together and looking for new ways. New opportunities always surface, and I want to be flexible about how we do that. However, I'll also say it always wasn't rosy. There were some challenges that we had to work through. Securing external funding to sustain some partnerships was a challenge, particularly on the federal level, with some changes that have occurred to grant dollars. We've not been successful on that front. There is some work in progress to continue to grow that. And I would say working across systems and teams. So we're 2 different institutions, even though we're under a board of regents, we have 2 different systems. And so trying to have flexible, unique partnerships isn't always supported by some of the rigid systems that we employ, particularly through fiscal and HR. So managing some of those things has been a little bit of a challenge as well. but something I think that we've been successful through, and excited to continue to partner for all the reasons that we've talked about before. I think I'm probably out of time, so we'll move to the next slide. But it's my privilege now to announce Vicky Ramirez, Program Manager and Senior Research Coordinator, Center for One Health Research at the University of Washington.
Great, thank you so much. And I'm really excited to be here today talking to everyone. My name is Vicky Ramirez, and I'm the Program Manager at the Center for One Health Research at the University of Washington and co-director of the One Health Clinic, which I'll be talking about today. As I talk about the One Health Clinic, I am coming from the University of Washington, but I'm also representing Washington State University, a public land-grant university, and their College of Veterinary Medicine. As public and land-grant universities, we are entrusted to better the lives and people of all the people and families in our state, and not only our own students, faculty, and staff. We also know that public trust in higher education is a real threat to our institutions and the impact we create for the world. In Gallup's most recent survey, published just this year on July 13th, only 38% of Americans have a great deal or quite a lot of confidence in higher education. And so people are questioning the value of higher education. Are we preparing professionals for modern workforces and issues? And is the value and affordability of our degrees? I will be talking today about the One Health Clinic, an applied research and training setting, which is, and I am biased, sorry about that, a great example about how public and land-grant universities accomplish their mission for students and communities. So today I'll be talking about the human-animal bond as it relates to those experiencing homelessness, and how the University of Washington, which I'll call UW, and Washington State University, which is WSU, work together to create a clinic that uplifts the human-animal bond, which not only makes companion animals healthier, but also their caregivers and or owners. And just for some background about the why we made this clinic, when we talk to those experiencing homelessness with pets, you hear reoccurring themes where the pet is everything to them. Their family. They are someone that loves them unconditionally and without judgment. Most will prioritize the needs of their animals over their own needs. In early interviews in the community, one individual said to me something that has really resonated over the last 10 years, and I use this often in presentations, so if you ever heard me talk about the clinic, you'll have seen this before. But this individual said, "I have to have her." And I think every homeless person, I think every drug addict, I think anybody that is going through something where they think they are at the bottom, that they don't have anything left, they need to put something first. And there's times when I was trying to quit meth over the last 2 years where I got out of bed because I knew she needed to use the bathroom. I didn't kill myself because I knew that she needed me. If you put something before yourself, oftentimes that one decision keeps you from doing the bad thing. What does the dog need today? If the dog's okay, I'll be okay. So, from the human, clinical, and psychosocial perspective, we know that there are positive impacts for animal companionship, including both emotional and physical support, health benefits such as cardiovascular health from walking dogs, physical protection, and general companionship. But we also know that there are some negatives, such as access to buildings and housing, access to healthcare, risks of zoonotic disease, cost of caring for animal, and the impact of negative animal behavior. Through reading the literature and from formative research, we know people experiencing homelessness take very good care of their pets. And we decided to leverage that human-animal bond and create a clinic that would care for both pet and pet owner. So in 2018, the UW and WSU came together to create the first of its kind joint veterinary and medical care clinic utilizing an integrated model of care. The flagship clinic was created at a youth and young adult shelter in downtown Seattle. Primary care for the humans is provided by Neighbor Care Health, a federally qualified health center. And this is Anina Terry, a trusted nurse practitioner who provides broad spectrum primary care. Veterinary care is provided by WSU's fourth-year veterinary students and faculty lead and clinic co-director, Dr. Katie Kuhl. There are not enough animals in rural Pullman, where WSU is located, for students to do all their surgical practice. And so they come to Seattle for their surgical and community rotations, and we benefit by having them provide care at the One Health Clinic. And it's called the One Health Clinic based on the One Health model, which suggests that human, animals, and environmental health are interrelated and that we cannot enact change in one without considering the others. So at the One Health Clinic, we scan for and address environmental factors that can negatively impact the health of both pet parent and their companion animal. The care provided for pet and owner are integrated, and the human and animal healthcare teams work in tandem to create a single healthcare plan for the family unit. So the vet care informs the person care and vice versa. The University District Street Medicine team at UW, which is a graduate-led volunteer club made up of students interested in health sciences, play an essential role in the integration of care through their role as navigators. We are training medical and veterinary professionals by serving real people in real-world settings. One of the roles that the UW plays is in research and evaluation of the clinics that we have. We published a paper last year showing the impact of our clinic. And before I show you the results, I will add here that we have a protocol at the clinic where the pet owners need to at least say hello to the human healthcare team. They don't have to have a human healthcare visit, but you'll see on the next slide that most do, even if they came in that day saying they did not want or need care. So in looking at 4 years worth of data, over 80% of all clinical visits resulted in human healthcare, including 69% of those visits where on intake, the clients initially said that they only came in to get care for their animal and that they did not need human healthcare. Of the 88 clients who came to the clinic, 75 clients saw a human healthcare provider. 40 of those had not accessed human healthcare for 2 years prior, and they established care for the first time with Anina that day. Of those new clients, 85% had one or more follow-up human healthcare visits in the following 24 months, even on days when vet care was not provided. So many in this community have not had positive experiences with healthcare for many reasons. And at the One Health Clinic, people are accepting human healthcare because they had a safe, positive veterinary healthcare experience. They are seeing human healthcare teams support the relationship that they have with their pets, which makes them more willing to access services for themselves. I will restate here that the One Health Clinic is also an interprofessional training clinic. We have the next generation of veterinarians, nurses, MDs, public health workers, social workers, and so on, learning the value of working collaboratively in this clinical setting. Our students will go on to create impact and value for communities, utilizing these skills of trauma-informed care and interprofessional collaborations, and being fully prepared to lead workforces in these critical times. As we plan future activities, we turn to piloting One Health clinics in rural communities near WSU. We're exploring collaborations with tribal healthcare providers on tribal lands around the state, and we also think that this would be an invaluable clinical model with aging populations of all social classes across the state. So this type of innovation, workforce preparation, and community impact that can only be made possible by higher education with public land grant universities working creatively and collaboratively. Programs like the One Health Clinic, those that prove the value of our education and community service, help higher education tell their story better and have a better story to tell. And like Dr. DeDecker said in his talk, I will say that the creation and success of this clinic also has further enhanced other collaborations and other programming across the universities. So there's more community projects, more research collaborations, and more partnerships occurring now. So I'm so proud of the One Health Clinic teams at WSU and UW. People in our state are well aware of our university's rivalry in football. And I'm supposed to say, go Huskies now. Yeah, it's collaborations between Washington's public universities that help people see a different side of our universities and the impact and value we create for our shared communities. We are lucky that our leadership, President Cantwell at WSU and President Jones at UW, who just last year was Chancellor of the University of Illinois Urbana-Champaign, which is a land grant institution, they are leading us into this collaborative future. So yeah, thank you for the opportunity to let me brag about our clinic. And the QR code that was on that slide sends you to a free toolkit that helps replicate that model in your communities. And with that, I return the stage to Chancellor Agarwal. Thank you so much.
Thank you, Vicky. That was wonderful. And guess what? Everybody stayed in time. Actually, we have a few extra minutes here. That's wonderful. For the people attending this webinar, if you have questions, if you can put them in the Q&A box, they will be curated. In the meantime, I was just thinking about these wonderful collaborations that we heard about today. From Alabama, I'm just amazed at your results of how many people stay and work there in rural areas. That's incredible. You must have something really special going on. So I think we'll have to have, after I got some time, talk about how you're doing it. UAB has done wonderful work. And Dr. Dedecker, I mean, you lit a fire there in terms of collaborations. It seems like this is something will be great to see how it continues, but I think it will go beyond what you just started by bringing the faculty together. And then lastly, Vicky, what a powerful testimony from that one individual. It just makes you stand still and think for a minute. And you said something that really resonates with me, which you said, our job is to serve all the people. And I oftentimes talk about that here. Although we are place-based, we are urban. One way to look at it is when the state contributes money to us, and they contribute, maybe not as much as I would like to, but they do contribute a significant portion. It's taxpayers from all over the state. It's not just taxpayers from the KC Metro. So therein, I think we have a duty to see what are the needs of the rest of the state. And if we are best able to meet those needs, we should look for those collaborations without trying to displace other universities, but look for collaborations so we can better serve the people. The other thing that stood out for me is the fact that in a lot of these collaborations that you've talked about, it took intentional leadership and sustained effort. A couple of you mentioned your presidents and chancellors. Somebody decided that this was going to happen. And at least the message came from the top that this needs to be done. And then people really put their shoulders to the wheel to make it work. And if you have shared challenges across the state, that's a good way to then look for shared solutions. And I think that's a driver. All of our institutions have something unique, if not at the discipline level, then at the faculty level. And how do we bring those unique things together to better serve the people of the state? And at the end of the day, it's collaboration that will have statewide impact. Each of us trying to do our own thing, perhaps the days of that are gone, and we need to look for more collaborations. I'll just say this, in the state of Missouri, we have 114 counties. It's a small state, but a lot of counties. Each one of them have elected officials down in Jeff City. What do they see when they look at UMKC just in Kansas City? Because they're in some rural area. Do they see us helping them in any way? Maybe not. And we got to think of that when they're passing laws and they're passing the budgets. What are they thinking of? So we need to do a better job, especially some of us in very large urban areas, to see how do we connect with the rest of the state and show that there's something worthwhile here in higher ed. As Vicky said, the impression people have about higher ed is plummeting by the day. So we need to make sure that we do serve the people. So with those themes there, let me just pause and see if there are questions that have come in the chat box. Jennifer, would you be curating those?
So we have a question for Dr. Dedecker. You mentioned additional funding support. What was the source of that support? And did other projects that were shared on this call, did you have other additional funding, either philanthropic, federal funding, or other kinds of external sources of resources? So I'll start with you, Dr. Dedecker, and then we'll go around to others that, in case you want to share.
Yeah, so when we started with the project, the 1.7 million that were usually invested came from state, federal, county dollars that we have within the state that invest directly in the community. So a large of that was Clark County dollars that we made sure were invested right in the community to serve. So the intention was to use that as seed funding and then to use external funding, partnerships, grant dollars as well. And we've done some of that, but just not to the level yet that we had hoped. So we continue to look at how we can use our dollars to support those partnerships that are important to the communities that we serve, but also look for sustainable funding long term.
Dr. Bram, I think you're next.
Yeah.
Yes, thank you. I had a question for Dr. Agarwal. I was impressed with your program to put medical students up in St. Joe. Are those students selected from anywhere in the state, or do you take out of state, or do you tend to emphasize only accepting students from rural Missouri?
We have not restricted it to rural students. They can come from anywhere, but what we have found is at least 50% of them are from rural areas. When I go visit with them and ask them where they're from, they usually start with, I'm from such and such. I don't know if you have heard of this place. And oftentimes I have not heard of that place. So I think it's kind of a magnet for them, perhaps self-selection.
I understand. Yeah, we have rural students from Slap Out, Wynot, and Bug Tussle, places that most people are not familiar with.
So, Dr. Bram, continuing with the funding piece, are you getting continued funding, direct support from the state for this program? How do you keep it going?
Yes, sir. Very early on, we managed to get a line item from the legislature from the Educational Trust Fund, and it slowly increased through the years. We occasionally get other funding sources from an outfit called the Alabama Family Practice Rural Health Board, which Dr. Mason happens to be the president. Not that there's any impropriety there. We also do research projects for the Alabama Department of Public Health and other entities on rural workforce studies.
Dr. Mason, I believe you are the incoming director, correct, for this program?
Yes, sir.
What are your impressions? Do you have anything to add?
I mean, I'm a product of the rural programs in the first place of the state. So, because we have two, and they're funded similarly, but the structure of both of them are different. So, because this is the one that actually partners with one of the land grant institutions, so that setup is different. So, I can speak from being a product and saying, because I practiced in rural Alabama for almost a decade in different parts of Alabama before I came to this position. So it's produced me. So I know from that point of view that it was useful, and especially the bridge year that we use that partnership with Auburn with. That bridge year, it's similar at the other program, but that became part of how I made it through medical school. So that partnership is crucial because that's a building year. So that's very important.
Well, what a great living testimony to the program. So congratulations. Vicki, how about your program there? Is it getting support from the state directly in some fashion, or the universities are trying to find resources to keep this going? You're talking about expanding?
Yes, you were talking about expanding. So the veterinary care it's a component of the vet students' curriculum. So that is not necessarily needing funding because it is a class that they're required to do. The federally qualified health centers that we work with, it benefits them to bring in new individuals into the clinics, and so they are being funded through their own mechanisms of FQHCs. From the UW perspective, we work on expansion, evaluation, and research. So it's a lot of grant writing. It's a lot of philanthropic searches. We had a lovely couple donate last year. One was a husky and one was a cougar, husband and wife. Yeah, so it's kind of a mishmash of both, and hoping that it gets traction within the city since we're showing actual benefits.
Actual results. Wonderful. Jennifer, are there other questions from the audience?
Yes, I'm bringing together a couple different ones to start with you, Vicki, and then I'd love for the other folks to chime in. If somebody was to replicate your program, I know you gave a lovely QR code. what advice would you give to them? Like, what did do you know now you wish you knew then to help them be successful implementing this program?
Yeah, we've learned a lot in the process. And through that, we've been trying to keep the toolkit up to date on the lessons we learned. And also, as a side note, we do quarterly free like coffee hours so we can help people in this process. What do we know? We've learned, actually, big thing we've learned is working with youth and young adults. A young adult will, if we say you have to go talk to the human health, they'll say, okay, fine. But if you tell a 65-year-old veteran who's been homeless for 30 years that they have to do something, want to do it. And so and that's a matter of like, they actually were seeing that they may not engage the first time or the second time or the third time. But when we see them the fourth time, they're like, okay, I'll talk to human health now. So everywhere this clinic gets implemented has to be adapted to the individuals they're serving, and it's very iterative.
Chancellor Agarwal, what advice would you give folks if they were trying to replicate the programs you're doing with dentistry and pharmacy and the multitude of partnerships that go into that?
Yeah, so you're correct. There were so many stakeholders and took a while to get everybody, but they all resonated with the idea because the need is so great and everybody feels it, especially in the rural areas. So it took a lot of work with elected officials at the state level. And as I said, a lot of them are from rural areas. So I didn't need to convince them, they were there. And for a change, they were ready to try fund this. Also, in the medical school piece, we worked with the hospital. So I had to find a hospital that was large enough and that was willing to be an academic medical school, because a lot of hospitals and doctors are not interested in that because it takes time from the practice to educate students. So that was another piece. Now, Mosaic Health was taking the long-term approach. They know that they need doctors in the future, and they have to try to recruit them, and they're having a hard time. So they thought of this as a recruitment tool. Of course, kudos to them for coming on and helping with this. But also our elected officials in DC, in Washington, DC, helped with this idea. So bringing all of them together, and then of course our faculty, we had to convince them that this was a program that would be beneficial to all. And so I think if the need is clear to everyone, it's not a made up need, or it will maybe good if we do this. It was very clear need that there are people who do not have access to healthcare. I think everybody came together rather quickly. So yeah, I would say it came together in 2 years. I was totally surprised because you all know how higher ed goes, we move like molasses, but this just came together, and 4 or 5 years later, we are graduating students who are going back. So it's been wonderful.
Dr. Bram and Dr. Mason, any advice you have for somebody who's interested in potentially replicating parts or all of your program?
Well, I'll go first, Alexis. Yeah, I think that, I've been interviewed by people from the WWAMI program wanting to know how we generate our outputs. And I think if you, get with your medical school and see if you can start a program aimed at rural people from your state. Nationally, only 4.3% of medical students come from rural parts of America. And if you can target that group and get with your legislator to support them, what we've done is we've gone to the State House and taken our students down there and, have them walk in to say, this is our rural medical student from Monroe County, the county that helped elect you, and just put in the face time. We're very proud that our 4-year graduation rate is 95.7%. It's 4 points better than the non-rural students at UAB Med School. A med school that I say humbly is rated the 30th ranked school in the country. Of course, I had nothing to do with that. But I think there's a lot of moving parts, but the very first thing is to generate some interest in wanting to put doctors in rural places to take care of marginalized population. When I go around the country, you know, in Montana, it was all about indigenous populations. The same way in Southwest. Same way when I went to Las Vegas, New Mexico at El Centro. There's a lot of Hispanic patients and a lot of Native American patients that are quite marginalized. But if you can get people from those communities to train and go back to those communities, like my friend Matt Probus out in Las Vegas, New Mexico, that's where the money is right there. And I will defer to Dr. Mason because she's from a very impacted part of the state. And that's exactly what we did in her case.
And I will say, because the reason I even knew about the rural medical programs in general was that I was a candy striper. I'm a little bit older, so I don't even know if they call them that anymore. So I was a candy striper, and literally the CEO of the hospital was like, I heard you want to be a doctor. And so he introduced me to the program. So recruiting was a big piece, but they had advertised in the communities and starting early as you can. If you're having a program to structure it by, I would say start it early as well, meaning like go recruit before they're even ready for you. Meaning like go ahead and start advertising, say, hey, we are developing something, or would you like to be involved? Because that community involvement and buy-in I thought was crucial to get me involved, right? So even on that end, I thought that was, you know, important as far as like community involvement, and then starting recruiting early on in the student's process, because that was in high school.
Another collaboration is with the area health education centers. My colleague in Huntsville, Lamont Dupree, runs the outfit here, and I'm his board president. I think that's an important element.
So there are a lot of collaborations that perhaps may not be as obvious, but like you serving on the board, chairing the board, and this other collaborations. I have a question for everyone, but before I get to that, I wanted to ask Jake, Dr. Dedecker, you had several areas and 2 of those grants were funded. What excites you? Where do you think this will go forward? Because not all the pieces most probably will likely be sustained.
I think with the common understanding that we have more alike than we are different, and where we can find those connections, where we can align our missions, where we can align the really objectives of how we can move forward as institutions that are serving the state, serving people, you can get behind that, and you can get stakeholders behind that. You can get others behind it that helps propel that forward. So I think that sometimes we get in the way of ourselves, but it really is that easy. And I think where we can find that common ground and build around it, there is momentum that we can carry forward. I think just a couple practical thing is you need to have a carrot and get faculty involved. So don't forget about what does it mean for them. And you need to motivate that and make sure they're incentivized. And the other thing is don't sway on your mission and how you're serving, and make that kind of be a core of who you are. But I think there's a lot of potential, and I'm excited for the future.
That's great. You do have a wonderful thing going there. Question for everyone. What surprised you most when you started this or during the process of putting this together? Let's just start with Vicky.
What surprised me most putting this together? I suppose it was the dedication that all the individuals involved from the 2 institutions put into, getting this to work. It was Dr. Kuhl says that we're very scrappy. We are very scrappy because we got it going just with knowledge that this would benefit our students, benefit the community, benefit the animals, benefit the people. And so that, I suppose it shouldn't have surprised me because we were very excited to get it going. But just that givingness of all the individuals knowing that this benefited everyone. I think that.
From Alabama, Dr. Bram or Dr. Mason, what surprised you?
I think the thing that surprised me was the amount of need that's actually in rural Alabama. I practice rural medicine in Southwest Mississippi in a majority community of 1,200 people. And I thought that perhaps Alabama wasn't as impacted as that, and I was quite wrong about that. So I think the need and the embracing, how the programs have been embraced by the rural communities and how our rural faculty partners, how enthusiastic they are and what interest that they generate among the students. I think that has been the most surprising and gratifying thing.
For you, Dr. Mason?
That part I would defer to him on.
Okay, Dr. D. Decker?
Yeah, in
What
my
was surprising?
experience, situations like this involve both internal engagement and perceptions and external engagements and perspectives. And for me, it was maybe a little bit of a surprise on how easy it was internally to get people behind this and motivated that, yeah, we can accomplish this for the right purposes and let's go. Externally, perceptions of maybe why institutions shouldn't work together or challenges on why they come together were also probably more layered than I anticipated. But I think both internal and external are important to consider.
You know, I'm going to ask, before we hand it back over to Chancellor Howell, I do want to ask each one of you to think about what advice he would give to the people listening in. But before I do that, there's one thing that we have not talked about, although we have talked about the enthusiasm we found amongst people. When two different institutions who oftentimes are football rivals or rivals in the state in other ways, there has to be an element of trust when you start. Talk about that a little bit. Did you see that? Did you have to face that? How did you build that trust? Vicky, did you have to work on that despite the football?
I think so because we've been so programmed to be competitive for the the scarcity mindset that we have to make sure our institutions are represented and I think within the teams on the ground the trust was very easy. And I think it took a little longer for maybe the institutions to um to know how to tell the story of a combined collaboration. Um, and so, yeah, I think we're 8 years in. I think the trust is solid now. But maybe the first 6, 8 months was just like, okay, can we do this? Can we not do this? Kind of thing.
You know, for us, especially as we are working on the dental school piece with Missouri Western University that we have not partnered with before, the trust piece, they have a lot of space available. So we were thinking of putting the dental clinics. But then we took it beyond. I mean, it's still not done because the state did not get funding to that one-time capital funding to this program this year. But nevertheless, we also talked about additional programs in a show of good faith, which is, they have a lot of undergraduate programs, but no continuing graduate programs there. And so talking to them about pipelines where the students can come into master's or PhD programs with us. So thinking more broadly also helps. So it wasn't like we're swooping in just trying to take your students. Well, in that case, they didn't have dental, but nevertheless, they could feel a little threatened. Why are you moving into St. Joe? You're a bigger university. So once we started talking about a win-win for everyone, I think it went rather fast. Dr. D. Decker, did you have to face trust issues?
Yes, and I think it was important for us at the time to have both presidents and provosts in line that did that message together, did the video together, and sent that out very publicly. I would say that there's still trust, I think, that we go through and we work through with some individuals. Maybe as Vicky said, it was easier for some of our faculty and folks on the ground to be able to do that because they do that more every day in community engagement settings than others do. But I would say it's continual work in progress.
How about Alabama? Trust issues?
I think trust has really not been a huge problem. The collaboration we've had has been very straightforward and mutually beneficial.
Okay. Well, I just want to do one rapid round amongst all of us folks here. And that is, if you could tell the participants some advice, what would you recommend that they do? How do they approach this issue of collaboration? If you had one thing to say to them, what would you say? Dr. D. Decker, maybe you go first. You're on top of my little window here.
Think big and don't be shy. You don't know unless you reach out and ask a question. You might be surprised at the collaboration response you get.
Dr. Mason, you have any thoughts since you are in charge now?
I think I heard it was Dr. DeDecker had said that keep your kind of your mission, what your purpose is in view, and kind of keep that in mind when you're going forward. Because I think that will always kind of guide your determination, your moving forward in whatever you're choosing to do with the program or endeavor.
Dr. Bram, any wise words?
Yeah, well, I would say, just don't be discouraged. No is just one of the responses you can get. I remember trying to start the integrated residency about 7 years ago. A lot more people told me I could never do it than encouraged me. So I just didn't listen to the people that were naysayers.
Awesome. And from Washington.
Yeah, it's on the same lines. Like gather the people. You know that this is going to benefit people. This is going to benefit students. It's going to benefit the university. Just gather the people that you like working with and just move it forward. And yeah, if you build it, it will come type of a thing.
That's wonderful. For me, it was, the number one, if you identify the right need, which is truly a need of the people, not something your university needs, but truly a need. And then, as you all said, being very intentional, not taking no's, and being bold about it. And I think people then come around and the trust is built. So, well, thank you, all of you. I think at this time we are getting up to time here. So I will hand it over to Chancellor Howell to close it for us.
Thank you, Chancellor Agarwal, and thank you to this panel, expert panel. Today was absolutely awesome to hear this discussion and to hear the perspectives from all around the U.S., West Coast, out in Washington, Alabama, Missouri, and of course, Las Vegas as well. So I want to thank you for your words of wisdom today, and hopefully someone will be encouraged with future partnerships. Chancellor, you are correct. There are a lot of issues in higher education, but the best way to show the need for higher education is exactly what you and this panel discussed today. I also want to thank APLU, their dynamic team that's represented here today. Thank you for your leadership, not just for today, but just for all the things you do to bring all the public universities, research universities together. And I also want to say this interest in collaborative partnership between urban and rural serving universities, we definitely need more of that. We all can work together a lot better than what we've done in the past. With the growing demands and expectations placed on our institutions of higher education, collaboration between urban and rural universities, it's important because each bring the unique strengths, resources, and perspective that not only benefit our students, but it benefits our faculties, our community, and our society as whole. And the statewide presence of land-grant university aligned with public universities can expand the value proposition for all of our states, but more importantly, for the constituents that we serve. So I want to thank everyone for taking time to attend this webinar, and I hope that it is only the beginning of the many future conversations. Our best wishes to everyone to have a great summer, and look forward to seeing you at another APLU meeting. Take care, and thank you for being with us.